name is Steve Yang. I'm the chair of the Committee of Medical Student Education for the American College of Surgeons. I'm extremely proud and honored to lead this committee. We've had a number of webinars aimed at medical student topics, which you can find on the ACS website, ranging from transition to being a third-year medical student, to learning how to apply for residency and what to do after residency before you become an intern. And tonight we decided to focus on one transition point, that is, how do you do well on your clerkship? And this, happy to say, has been the most popular topic. I think we have over 1,000 students registered from all over the world, and tonight looks like we have nearly 500 people on the website. So, congratulations to you all for coming. I want to thank several people first. Dr. Sachdeva, who's the Director of Education for the American College of Surgeons, unfortunately cannot be with us tonight, and he usually leads us off in this discussion. Patrice Blair, his assistant, to our great assistants at the ACS, Kim, Cassie, and Diane, to the rest of the committee, and especially to Maddie Sauer, who's one of your colleagues, who has done probably a wonderful job with the social media blast and trying to get you all here tonight. I'd like to turn the moderator position over to Dr. Paul P.J. Schnartz. He's our vice chair of the committee. He's a well-known surgical educator, won numerous awards. He's also one of the Masters of Surgeon Educators with the American College of Surgeons. Currently, he's a professor of surgery and the Associate Dean for Clinical Affairs at Creighton University School of Medicine. And so I will turn it over to Dr. Schnartz and the wonderful members of our committee who will introduce themselves. So again, I want to thank you all for coming. One more thing I would always forget at the very end, please stay till the end and fill out the surveys. We really need your feedback because that will help us plan future webinars. So PJ, take it away.
Oh, thank you, Stephen. And just one minor correction. It's always bad correcting the boss, but I am actually professor and associate dean at Des Moines University, which is in Des Moines, Iowa, and a professor at Creighton University, which is in Omaha, Nebraska. So
it's because I can't keep up with you. It's like you change like dean jobs every like 6 months, but I'm sorry, my bad.
So Dr. Yang is from Hopkins, and he is on the East Coast, and probably views all of us Midwesterners as being one just giant conglomerate of people. But listen, gang, it is a pleasure to have all. Right now, I see we have 506 participants with more coming. And tonight we're going to, I think, have some fun and hopefully pass on some good information. This is really meant for the rising second year students who are interested in surgery and want to succeed moving forward. And it also, I think, applies to students who are in their third year and want to stand out when they do their audition and their acting internships in hopes of getting a residency. So I think we're going to have some fun. I will tell you that being a surgeon has been one of the great joys of my life, and I wouldn't trade it for anything. Tonight we have gathered a really amazing panel of people. We have Dr. Lau, who's a professor at Loyola University in Chicago. He does minimally invasive work. Next we have Natasha Kierig, who in my opinion is one of the brightest rising stars in surgical education in the United States. She's at the University of Arizona, and a woman who I've looked up to my entire career is Dr. Barb Pettit, who's from Emory University, and I have actually even heard her sing. I have not heard either Natasha or James sing, but I tell you, I think all of these are going to be fabulous talks, and I don't want to take away from any of their time. I will be monitoring the chat, and we'll try to coalesce any of the questions that you have for our panelists. We're going to start with Dr. Lau from Loyola, and then go to Dr. Carrick, and then Dr. Pettit. We'll allow some time for some questions and answers. And then as we end, we're going to have each of the panelists give their just 3 quick sentences of advice to take home with you. So let's have a good time, and welcome to the world of surgical education. It is truly, in my opinion, and as somebody who started as a pathologist in another life, really just a wonderful field, and excited you can all join us. And as Dr. Yang said, if you could please fill out the survey, that would be great. So with no further ado, I'm going to turn this over to Dr. Lau for his portion of this.
Perfect. Well, thank you so much. I'm so excited to be a part of this panel, and it's been great being part of this committee. And I can't sing, PJ, but I can present patients. So I am going to be talking a little bit about making your presentations pop, and the titles of each of our talks were created by Dr. Yang, and he likes to make the titles pop. So as I start, the goal of a presentation or presenting a patient is to convey information about that patient to people who may or may not know the patient. So we have to remember why it is that we're trying to present patients. The why is it important to hone your presentation and to present the patient well? In medical education and the core clerkship, a lot of what the attendings and or the chief residents or the team sees in order to evaluate you or to assess you on your core clerkship is your presentation. So that's why it's important for you to be able to hone that. It's how you're seen, it's how people assess your medical knowledge and your clinical skills. So the key in making your presentations pop, or one of the tips that I can give you, are to remember the context of your presentation, but also to remember who you are presenting to. So if you're going to be presenting a consult or a patient who the team or the attending may not know, and this can also be in clinic, then you're going to want to include most of the particulars and be a little bit more broad. But if you are presenting on daily rounds in the morning, which is more like work rounds, then you're going to want to go a little bit quicker, but you want to not forget the pertinence. A lot of students, when they come on the core clerkship, think that there's a difference between what they were taught in as an M1 or an M2 to how they're supposed to specifically present patients on their surgery core clerkship. And I don't think that there really is a difference. What you learn has been good. It's a good foundation and a good template to use. But when you are on the surgery core clerkship, depending on whether you're presenting a patient that is known or not known, you're going to want to hone it down and to use the core that you already know, but to present them in a concise fashion. Work rounds are time sensitive, so if the patients are already well known, then your core will be quicker. If you're on teaching rounds, and you can tailor your presentation around questions that are interesting through the patient's history, or things that you may want to know, or things that you may want to teach. The basics are the core. So what you've learned specifically as an M1 and M2 are that your presentations should consist of a subjective, an objective, an assessment, and a plan, or what we call the SOAP format. On surgery, the subjective should be a one-liner, especially in the morning. For example, Miss Sanchez is a 34-year-old female who is post-op day 1, status post-laparoscopic cholecystectomy, and is here overnight because of pain control. Your object would be the data or the numbers. including your physical exam. And then your assessment is, what do you think is going on? If it's a new patient, then you may be presenting a differential diagnosis. But if it's a known patient or one that's fairly straightforward, then your assessment may be a diagnosis. Your plan may be diagnostic, therapeutic, or both. And one of my students told me that the way they choose their data to present has a lot to do with what they do with their assessment and plan. And that's a good way to kind of cone things down. And then if you see your presentation as a part of your comprehensive care of the patient, then you should do the note as well as your presentation. You should complete the care of your patient throughout the day. And if you get to know your patient, you will become enthusiastic about their care, and enthusiasm counts loads on the core clerkship. It's so much fun teaching and being with people and caring for patients with those that like what they're doing.
Well, I'm so happy that I'm following Dr. Lau's presentation, because most of the information he has talked about is actually very important to the part that I will be talking about, which is nailing your notes. We'll talk about 3 things in specific: having a template, thinking about the big picture, and knowing your audience. So have a template. What does this mean? When you're going to examine and talk to your patient, you should have a template already in your mind. You will be filling out the information in this template as you're speaking with your patient, examining your patient in the morning, and preparing for your presentation. So it should be organized, and it should be something that is not new to you the day that you walk in to talk to your patient. You should have this down and should practice it. Many of you have already practiced this in doctoring or have some sort of ability to practice on a standardized patient. Make sure it is something that flows well for you. Avoid shorthand, especially that which is not standard and that which has been said to be not standard. Your notes should be able to be read well, and especially at your level, because you're still learning and you want to make sure that your notes are clear and thorough. And lastly, do not copy and paste notes. This is very poor practice, especially when somebody's reading your note and you happen to have the date of service, which is 1 week ago. Right then and there, people don't trust what they're reading following the rest of your notes. So do not copy and paste. It should not take you very long to write your notes, and make them authentic, make them yours. Think about the big picture. Dr. Lau also spoke about this. It is extremely important, especially at your level as you're entering into your clerkships, to really start to think about the differential diagnosis. After you've collected all the data and spoken with your patient and are planning to write your note, sit down and maybe take 5 minutes and think about what is going on. Work through that differential diagnosis. That's the crux to being able to actually work through your plan as well. Articulate the assessment. Don't be afraid to say what you think is going on, and have a succinct plan. Don't put a plan in that says, I will speak with my chief resident and create a plan. Have a plan. Lastly, know your audience. It is really important to know that patients can read and request your notes. It is also important to know that many of your residents and faculty, nurses will be reading your notes. Make sure they are well articulated, well written, professional. Your notes become part of the medical record and are a legal document.
All right, so my turn. And I just want to say a comment about what Dr. Lau and Dr. Carrick have said. Many of you are thinking, geez, I don't know how to put a plan together. You know, I'm not that far along. But if you think about surgical patients or any hospitalized patient, what is the one thing they want to do the most? They want to go home. So when you're thinking about your plan for the day, think about the things that will move the patient closer to the door, okay? If they're doing well, are there tubes that need to be removed? Is it time? Are there medications that need to be stopped? Is it time? Those are the first things you can start thinking about as a medical school. So I'll just throw that out there. But what I'm supposed to be talking about now is one of the biggest bugaboos of the surgical clerkship, and that is the fact that while you are a professional on a team now, taking care of patients in a professional working environment, you are also still a student. And most of you will have some kind of assessment at the end or somewhere in the middle of your clerkship that you have to study for, that you have to prepare for. The problem with the surgery clerkship, at least most of them, is that the hours are long, you're going to be tired. And when you do have free time, you're going to wanna, and yes, you should, spend some time, your free time with your significant others, your friends. You've got groceries to buy, your refrigerator is empty. You want to work out, your body is complaining because you haven't gotten a run in a week and a half. And the other problem in terms of studying is that long periods of time to study are a luxury when you're on almost any clerkship, including surgery. You don't have the luxury of entire afternoons or entire evenings or entire days to sit and study. All right. So the first thing I would say, and this is what I say to my own students, because I'm a clerkship director, before the clerkship starts, know your learning style. What is it that you get the most yield out of when you study? And if you don't already know this, then you really need to work on trying to figure out how to make your studying more efficient. Do you make outlines? Do you draw diagrams? Do you like to read books? Do you like to look at apps? Are you a visual person? Are you an audio person? Okay. Know your learning style, because that's going to start setting you up in terms of your studying through the clerkship. Before the clerkship even starts, contact peers ahead of you for resources. You all probably know a few. If you're an M2, you know an M3 or a few M4s. Even if you don't, find some friends who know them and ask them, what did they study? What was good for them? How did they find, for the surgery clerkship? It's perfectly fine to send your clerkship director an email ahead of time and say, hey, what books do you recommend? What resources do you recommend in terms of studying for the clerkship? And also know what's available through your university and your medical school. At Emory, we have Access Surgery that's available through the university library. So students have a whole plethora of things, a lot of textbooks, a lot of videos, a lot of study guides and question books that are available to them through that. And your clerkship director probably knows those things that are available, but contact your library about that. And the other thing is, the American College of Surgeons has an amazing medical student curriculum and a surgical skills curriculum for medical students that you can access that provides reading materials and questions on all of the basic stuff in surgery, as well as, if you're going to get to put an NG tube in tomorrow into a patient, you might want to quick look that up in the surgical skills curriculum so you know how it's done. Then set your home environment up for studying. Get a space, a quiet space. TV shouldn't be around. Put your study stuff in that space. And the most important thing, to be honest with you, if you live with roommates or a significant other or family members, manage their expectations of how much time you're going to be able to spend with them when you're at home. And that means also managing the fact that, you kind of have to spend some time with them at some point, but let them know that there will be times when you have to come home and study, or this weekend, you're going to have to set aside this amount of time to study, but after that, you'll be ready to go out and play Frisbee, okay? Manage their expectations, or they are going to be terribly disappointed when they don't see you for however long the clerkship is. And get organized at the beginning. I always tell the students, especially if you have to study for something like the National Board exam, shelf exam, the subject exam in surgery, which is a big multiple choice question test. Know what topics it covers, whether it's a departmental exam, whether it's an OSCE or oral exams, whether it's what we call the shelf exam from the national boards, whatever kind of exam you're expected to review, to read for, know what topics you're going to need to cover, and have a calendar every day of what topic you're going to cover that day, whether it's reading or doing questions. Here's the deal. 3 weeks into the clerkship, you're going to come home, you're going to be exhausted. You're going to say to yourself, oh, God, I can't remember what I've studied already. I can't remember what I'm supposed to be studying. I don't know. But if you set up a calendar and it sounds very OCD, I know this, but you will bless me if you do this, because 3 weeks into the clerkship, when you come home really tired and you just want to do a few questions before you go to bed, or you want to read a half a chapter, you can look at your calendar and say, okay, I'm supposed to do 5 questions on ortho tonight, or I'm supposed to do 5 questions on transplant, or whatever is on the docket for that day. If you get organized and set up some study time, however small, every day, you won't have to leave all your studying for your time off, which is a really bad idea. And the reason I know it's a bad idea is because I did it as a student. I would get home, I'd be tired. I would say to myself, oh, I'll study this weekend. I'll do 100 questions from UWorld on this, on Saturday. Well, you're exhausted. Saturday comes, you sleep until noon just to catch up on your sleep. That's your day off. Your friends, people want to go out with you. You want to have a good time. You got to pick up your dry cleaning. You got to put some food in the refrigerator, whatever. You get to the end of the day and all of a sudden you're like, I was supposed to do 100 questions today and I didn't get to it. And then you're kicking yourself because you didn't get to it. That's just it's not setting yourself up for success. Okay. Little small bits every day, and setting up your calendar so that some of those days are review days, because we know from the way people tend to learn is that once you learn something, a week or so later, you have to review it a little bit, okay, to make it stick. All right. And then last, you're going to have to learn to study in small chunks. Those of you who like to sit down and spend 3 hours doing questions, making diagrams, making outlines, going over flashcards, however you learn, you're just not going to have that kind of time on the surgery clerkship, okay? So have things available to study in small chunks. So in between cases, or while you're waiting to make rounds, you're waiting for the attending to get out of the OR or whatever, have a resource. And by the way, the phone is the most amazing resource. Have study for your next day's cases during those times, okay? You got a little time after lunch, you know what the schedule for the day is going to be the next day. Study for your cases that are going to be in the next day. And then in the evening, do a few questions or some reading for your end of rotation exams. Because here's the problem for the surgery clerkship medical students. You not only have to read up on your cases for every day, but you do have to read and study for those exams. And sometimes people get overwhelmed, and instead of doing little chunks each day of both, they feel like, they start to get really overwhelmed, and it can be overwhelming because you're going to be busy. And engage people to help you. All right. What might ask the residents if you have to study for an OSCE or an oral exam, ask the residents to give you some cases to go through with them. Get your classmates into a little study groups. Okay. And the peers ahead of you. I mean, one of the most successful things we've done at Emory is have peer mentors, and they're M4s who love surgery and want to help M3s. And they're available to help you study. So you can do that on your own. It doesn't have to be an organized program. And one of the questions you can ask as you're studying is, if I'm studying for a case for tomorrow, think about how might they make this into a question on the shelf exam? Okay, what are the questions that might come out of this topic that I'm reading about? And if you can get yourself organized and do some of those small things, learning to learn in chunks, because to be honest with you, that's what all of us do now. There are very few of us who have children and families and practices, and we're trying to do research, or we're trying to do whatever we're trying to do, and we have hobbies like we sing. Then we don't have the time to do things in big chunks anymore. We learn to do small chunks of learning and keep up with things.
Let me ask a couple questions. We have some questions from the Q&A, which I will keep up with as well. But let me maybe start with the presentation. And so, Dr. Lau, how I'm taught in my first 2 years that I should have everything in my presentation, but when I get out on the floor, the resident or the attending they just want it concise. How do I know what to keep? How do I know what to throw?
I think the best thing to do is kind of know your patient. And then of course we talked about the context. So if it's a newer patient, if you're seeing a consult for the first time and the attending and or the resident doesn't know about anything about the patient, they're going to want to know more about them. So you want to throw out less. But if we're talking about a post-op patient or a patient that the attending knows from clinic, then you want to just keep it down, at least on the subjective part, to a one-liner, just to remind the attending or the resident who the patient is, and then the pertinent data, and then just keep the exam and the data down to what you think you're going to present as an assessment. And if you are able to present the plan, then you're going to want to be concise when it comes to presenting the plan.
Excellent. Let me ask another question while we're starting to get them in now more quickly. But Barb, if I can ask you, when is the best time to contact the clerkship director to see what's there? And I see a lot of my friends a year ahead of me looking at books that seem to contain really more buzzwords than concepts. So when should I do that? And how good are these buzzword books that just tell me that, they don't seem to really be helping me. What advice do you have?
Depends on how you learn. Some people learn from buzzwords because they can attach concepts to buzzwords. But if you can't, that's not your style, then what you want to do is, you can contact the clerkship director a year ahead of time. The problem is you're probably going to be studying other things besides surgery. So you don't want to take away from whatever clerkship you're in or whatever courses you're in before you get to the clerkships. But I get emails all the time from students who, would like to know, is there a book, is there a resource that I can use? And I usually ask them, how do you learn best? Pistana comes as an audiobook, all right? There are two, there are probably more, but D. Virgilio and Lawrence are textbooks that are both written for medical students. And the medical student surgical curriculum in the ACS website has also been written, obviously specifically for medical students, which means they're going to keep it to the stuff that you really need to know. They're not going to get into long treatises on the history of inguinal hernia and Hesselbach's biography, okay? You need to know Hesselbach's triangle, but you don't necessarily need to know who Hesselbach was. So I would say contact the clerkship director, find out what resources you have available, not only from the Department of Surgery, because they will probably be using some sort of a platform like New Innovations or Canvas, at least we do, where they put things for you, but they will also know what the university or the School of Medicine provides. And hopefully they've kept up with some of the apps and things. There are some great apps out there, folks. Surgery 101. There's a couple of others, but there are some great apps out there that that are made for specifically for medical students to kind of to review on the fly. And so you will be able to find those things if you look, if you contact, especially the peers ahead of you. If you can contact people in the year ahead of you, they usually, if they've done the surgery clerkship, they're usually a wealth of information.
Wonderful. Thank you, Barb. Let me ask Natasha a question. You know, one of the problems when students are presenting or writing notes is, you know, they get interrupted. They're told by, you know, resident A to write their notes or to present in this particular fashion, and then they change services, and now it's a new service. And they're told to abandon what they've learned before and do it this way now is the right way. Which way really is the right way?
Honestly, the way that makes most sense to the student in terms of staying organized and in order of what they had learned prior is the best way. It is very challenging starting on a new rotation or even a new clerkship to learn everything, but that's part of medical school. And that is the whole process of learning, is how people do it differently or slightly differently. But the core, like what Dr. Lau was talking about, the core is always going to be the same. And it's really up to the student to stay in order. So yes, you might get interrupted and somebody might say, okay, hurry up. We don't really need to know that. That's okay. Stay in order in your mind. Skip through until they ask you if they want to know some of the pertinence. And that's always important to at least mention. And don't get flustered. Stay with your organized template. I think that is very important. Learn from what everybody is teaching you and learn your own art, and eventually it'll stick.
So let me ask another question. I don't know which one of the panelists want to get this, but it just came through the question. I think it's a good one. We've talked about how to stand out with note writing and studying and how to stand out you know, with verbal presentations. How do you stand out in the operating room? And I'll leave that open to anybody, because I think that's a challenging. My advice is always, you know, be actively engaged, ask questions. That's okay, but ask smart questions. But what do you guys think?
Well, I'll take that one. Be there when the patient goes in the operating room. Help the nurse, the circulating nurse and anesthesia, watch what they do to get the patient to sleep. That's part of your education. And, you know, it really depends on the surgeons. And it also depends on the case. If the case is very intense and requires a huge amount of focus on the part of the surgeon and their assistant, then they're not going to be inviting you at many times to come and see the anatomy. Okay, they are going to be focused, as they should be, on that patient and getting that patient's operation done safely so the patient does well. But you'll be able to feel the tenor of the operating room. You will be able to feel when they're doing a case that, I hate to refer to any case as routine because that's the kiss of death, but you're going to be able to feel that people are reasonably relaxed, the case is going well, the attending is engaged in teaching the resident that they might be taking through the case. And at that point, you should have some questions already formed in your mind about the case. And this comes from and you may be asked questions by the attending. Most attendings will assume that you have read up on the pathophysiology of whatever the patient has and the pertinent anatomy of how the procedure is going to be done. All right. So you should know those things in case they look up suddenly and say, all right, tell me about the critical view. So you don't want to be caught. And you know what? The day before, you can ask your intern or one of your residents, what are the things I might get asked about on this case that I'm scrubbing in the next day? Because they'll know. But you have to take the pulse of the room. And if the room is very tense, everybody's focused, it's very quiet, especially if the surgeon says, turn the radio off or the music off. It's probably a good idea to just wait until they ask you to do something like hold a retractor or whatever. If it's more relaxed and it's clear that there's teaching going on and there's some back and forth going on, then you can come up with your questions and also remind them that you're there. And because sometimes they just get involved and they forget that you don't know any of this, right? So it happens.
Let me ask Dr. Lau here. And, one of the things I see from the students is that they're told to read about their patients. But in the end, that means they're missing a lot of stuff that shows up on tests. What advice do you have? I mean, reading about your patients, like if you're in my field, a trauma surgeon, there are only so many questions as on gunshot wounds and old ladies who fall down stairs. How do you handle studying for things that you might not actually encounter on a daily basis?
Well, PJ, I think that if you're going to read around your patients, you should at least read around them so you know who they are. And if you're going to go into a case, know the anatomy. What I suggest, or what I've done in the past, if I know that I'm going to take an exam, the shelf exam has particular topics and particular percentage of topics that are covered on each of the exams. If you look through the list and there are things that stone cold, then I wouldn't necessarily spend your time to review those. If there are topics, or you're going through the core clerkship and you are not doing pediatric surgery as part of your rotation, then those may be topics that you want to target. And I agree with Barb. If you put yourself on a schedule and you put the topics down that you don't necessarily know or will be exposed to, and you put yourself on a schedule, you can cover those things. And even if you do 5 minutes a day, or some days you do 5 minutes, some days you do half an hour, I think all of it adds up. And I think you just have to keep yourself on a schedule.
So Natasha, one of the questions that's come up about note writing is how do I practice? Are there workshops, or is there a way to practice this?
Well, hopefully you've had some practice prior to starting your clerkships. And I know a lot of medical schools have that integrated into their curriculum, either something longitudinally where you've actually been exposed to some patients that you see every week, or maybe working with a mentor that allows you to come shadow with them in the clinic or into the operating room, or even with a standardized patient where you get to practice. But practice is key. And that goes with everything. Most of us don't give presentations on the fly or go to do grand rounds or M&M the night before. Most of us will practice, and you can practice, out loud in your room, in your living room, in your kitchen while you're cooking. Just practice out loud. Just speaking out loud will actually help you get the language that you want to use when you have to do it. So there's no book, there's no magic wand that's going to help you. You got to practice. You got to put the time in. And I would say do it 5 times. So 5 times before you go, and it's going to be your first rotation on surgery or ever on a clerkship. Practice about 5 times asking or interviewing somebody. Maybe interview your mom or your dad or one of your family members or your best friend. And guess what? You'll learn real fast on how you want to streamline your language and the time that it takes. So I hope that helps.
So I'm gonna stick with you, Natasha, only because you are the youngest of everybody here on the panel. And that is how, when you're looking up stuff online or on your phone, Dr. Pettit said the phone is a great resource. But I will tell you, I have gotten frustrated with students who are on their phone, and it's probably my old gray hair and fat body that says I don't think they're paying attention. What advice do you have? I think that's common.
I agree with you. I think it's the world we live in now. Even us carrying our watches that will ping us with messages and things like that. But really, if you're having to look something up while you are on rounds, you're not going to have enough time to figure out the right answer, and you're going to look bad. People are going to get frustrated with you, and they're going to think that maybe you're fact checking them, which also can be very challenging for a lot of faculty, because you really have to watch what you say too, because right now everybody can pull up their phone and fact check you. It's not the time. It's really not the time. Be present, be engaged. I think that's really important. If you don't know something, just say, I don't know. I'm going to look it up after rounds, and be done. Move on. I think that it is something that we have to be very cognizant. I have to do it too. A lot of times, I'm also a trauma surgeon. I'm getting paged. I'm overhead calls. People are interrupting us. I have to stop and just put my phone away and say, okay, I'm going to listen to rounds. Next patient. And then in between maybe patients, look at my phone for things. So it is a cognizant effort. And it is the world that we live in, but it is frustrating, I think, when people are trying to teach you and you're on your phone, even if you're trying to look up the right answer. Not the time.
EJ, I'd like to also say something about that.
Sure.
Don't be frustrated if there are times when it seems like you're not getting enough teaching. The attendings and the residents sometimes are hugely busy. They have huge amounts of paperwork. Well, it's not paperwork, it's electronic paperwork, but it's still paperwork that they have to take care of. They have all kinds of responsibilities. The service may be completely flying off the whatever with patients. And you're gonna get the sense that maybe you're just not quite the most important person on the team today, right? Or even tomorrow. So have a little patience with your team. This is a working environment. It is supposed to be a teaching environment, yes, but it is primarily a patient care working environment. And sometimes teaching just has to take a backseat to whatever's going on with patients.
I'm going to ask Dr. Lau. So we have a number of students who are either surgeries their first clerkship or second clerkship, or maybe they're an international student coming into a new environment. How best to stand out? What's going to make a good student, be them new or old, at the beginning of their third year, end of their third year, or an international student who's new to the system? What advice would you give in just a minute or two, just because we've got a ton of questions, which is awesome.
So what I would say to that is when you first get onto a team, it's a new team, everybody else has worked together, but you have not, is try to be explicit about what your particular goals are for the rotation, and to be explicit about the fact that this may be your first rotation, or that you are an international student, that you're rotating here for the first time, and then get specific advice from the residents on how to best be helpful during the service, and to identify any specifics to attendings and or the service that they may need to know in order to be successful. And then I would say, take advantage of the opportunities that you're presented with. If there are times when the residents are are doing their education, their protected time, use those opportunities to interface with the attending. There might be some cases they're doing. Ask them if you can be in on those cases that the residents are not. If you are in clinic with an attending and you see them in the operating room, then they're more apt to, to teach than if they are only seeing you for the first time in the OR.
Excellent. So Barb, I'm going to ask you what I think is probably going to be our last question. I'm going to try to type out as many answers as I can, gang, to your questions. If I don't, I will apologize. But I think these are as a combined difficult question. So I'm going to you, Barb, as my rock. And that is, what advice do you have for students who are being pimped, meaning being asked questions at the bedside that they don't know the answer to, or if the pimping becomes or is perceived as being a little bit derogatory, or maybe even sexist? I know that both of those could be full conversations, but
Yes, they could.
I know, and I'm giving you only 3 minutes.
So
because I consider you wise.
So first of all, remember that the stereotype of surgeons as very assertive and straightforward exists because, in part, it's sort of true. Surgeons like to fix things. They like to get things done. They like to make it better and make it better now, right? They're usually not terribly patient. Now, of course, there's exceptions to everything with chronic disease, or they wouldn't be surgeons. So get used to that style of questioning that's very direct, very kind of almost in your face. It might feel like that to you, because if you're the kind of person that's, somewhat either laid back or shies back, okay, sort of shy or quiet, it may come across as very in your face. It may come, and so you have to make a decision. First of all, is this just this person trying to help me out by asking me questions? And unfortunately, I just don't know the answer to many of them. Or if it's clearly that they are making derogatory comments about you, especially if they are in any way related to harassment, okay, your sex. I mean, I could tell you stories, okay, because I'm a really old person and I grew up in surgery when there weren't a whole lot of women. This is when you should be talking to your clerkship director about this, okay? Students should not have to put up with that. That's not part of the training anymore. That's not appropriate. And I tell my students, look, I want you to have a good time on surgery, whether you're going into surgery or not, because even if you're not going into surgery, you need to get something out of this rotation. And the most important thing you need to get out of this rotation is when to call a surgeon, okay? So if you're having trouble with personalities and it's just not going well, talk it over with your clerkship director. Because first of all, they probably know the residents and attendings way better than you do. And they can give you some tips about maybe how to approach them that might elicit a more productive response. And if it's something that needs to go further up the chain, that's the person to do it.
Okay, thank you, Barbara. I'm told I have one last question. I'm going to give this to Natasha only because I see Dr. Lau typing furiously, getting answers in that I can't type that fast. We have a number of students on who are first or second year students, and they want to be, they want to stand out. What can they do now? And this will be the last question before we have to close.
All right. So I really think that this is where mentorship is key, and really being able to connect with either a student that is already on the clerkship or a resident or a faculty mentor. Somebody that you need to connect with earlier would be the best. That way you just sort of get the lay of the land. You get more comfortable with the folks that you will be rotating with. They are also great resources for advice and being able to tell you how you need to prep. And a lot of the prep work is just being familiar and comfortable with the expectations of you. I think that is the biggest thing. So seek mentorship early. If you don't know where to start, go with student affairs at your College of Medicine. Reach out to the students that are above you in year. Reach out to residents and reach out to faculty. And most folks, I would say 99.9% of people want to mentor you, and they would love that. And they would love to offer you advice on how to do well. And I think a connection at your place or where you will be rotating is probably the best place to start.
Excellent. So I am going to try to type as many answers as I can. But what I'd like to do now to close out the session is I've asked each of the panelists to please summarize their best 3 pieces of advice in 3 sentences, which I think, because we could all talk surgery all night, but we'll start with that. And
Really, my advice for students is when you're on the clerkship, not just surgery clerkship, when you're a 3rd-year medical student, you're no longer an observer. You are not studying anymore for tests and only staring at a book. You are now a part of the team. You are the provider. Step into those shoes. And if you really want to do well, act like you're the only doctor that's taking care of this patient. Pretend like there's nobody else there. You got to get all the answers. You got to get all the tests. You got to follow up. You got to come up with an assessment and a plan. And I think when you start to think like that, you will start to act like that. And that is the biggest piece of advice I have is don't be an observer, be an active team member and pretend like you're the only person on the team that's taking care of that patient. And then the second piece of advice is know your expectations. And most of them are typed up in the surgery clerkship or a syllabus or most syllabi will have your expectations. Understand your expectations early on. That's extremely important.
So,
all right.
I would piggyback on the fact that, know your expectations when you start on various teams. On the first day or so, find out what the team expects you to do in caring for the patients and how to do so. In every patient encounter that you have, and especially if you're trying to convey information, think of who is the receiver of this information and when it is that you're giving them this information. And then find a particular part of the rotation or maybe all of your rotation that you really enjoy doing. And enthusiasm goes a long way and in making you get noticed.
Excellent. All right. And Barb, 3
get help.
sentences. Hard for you,
Yeah.
for us old people.
I know, get help if you're having a problem, a concern, or you're struggling. Get help. Don't wait. Get it as soon as possible. And your clerkship director, that's what they're there for. Okay. Make time for your self-care and recharging. And just like you're studying, you may be used to being very spontaneous. Surgery clerkship, you may have to start scheduling things like date nights and, workouts and being with your friends. You may have to start putting that on that calendar because if you don't, it's so easy for it to not get done. And then all of a sudden you're not taking care of yourself and you're not taking care of your peeps. And then the last thing I would just say is there is a huge, profound trust that patients put in their surgeons. And it is one of the most humbling and satisfying relationships, that relationship between surgeon and patient. And I urge you to observe that, because that's one of the things that's most fun about surgery is really the intimate connection between a surgeon and their patients.
Listen, I would like to first off thank all the participants. This has been hopefully a good experience for all you. I am indebted to each of the presenters. Really fabulous job. I'm indebted also to Dr. Yang, who has allowed us to pursue this and the college. So Thank you, guys. And please remember to do the survey. Stay safe out there, and look forward to seeing you on the next one. Take care.